As a physical therapist who specializes in treating scoliosis, I often get asked what exercises are best for scoliosis and what exercises should I be avoiding. And like so many things in life, there is not a clear-cut black and white answer. It depends very much on the individual, their level of fitness, familiarity with movement and exercise, the shape of their spine, many different factors. However, I will say that it is often more important to consider how you're doing a specific movement rather than what that movement is. This is because scoliosis is all about instability and collapse. When we treat scoliosis with exercise, we are working to help put the spine in a more stable position and avoid collapse into the concavities of the curve. So exercises that promote those things, that make it easy to maintain an elongated neutral spine, tend to be some of the best because they can help make sure that you're not going to be likely to collapse into the curve, that you're not positioning yourself in a way that the spine is potentially more unstable. So when we're thinking about what that means, lots of exercises that involve weight bilaterally on your feet. So things like a body weight squat or just any type of squat where you have weight equally dispersed and your goal is to maintain that nice neutral elongated spine can be good. Even things like a wall push-up or many variations of planks. So you can see you can try to maintain that neutral spine. Again, we've got equal weight through the feet here. Those tend to be nice places to start as you're learning to understand your curve and you're learning to figure out where you may be most challenged. So typically things that we're looking to see if your pelvis has shifted to the right or left during an exercise, if you're collapsing into the concave side of your curve, and potentially if you're getting more rotation through the spine back on the side that you already have rotation on. So a very important thing when it comes to selecting the right exercises for someone with scoliosis is having a very clear understanding of their curve, or if you're thinking about yourself, of your curve, and where your concavities are, where the rotation is happening in your spine. If you do have a tendency to have your pelvis shift to one side or the other, you need to be aware of that so that you can work with your curve to find exercises that promote stability, that promote your ability to maintain your postural correction out of your curve. So that's definitely the first place to start, is get a really clear understanding of your curve and what is your optimal correction. And then can you maintain that correction while you're doing a given exercise? A question that I always ask is, are you in your curve pattern? Yes or no? If you are in your curve pattern, that means that your curve is dictating your posture. It is something that we would maybe see that increased rotation, we see collapse, we see pelvic deviation. That's not what we're going for. We're working to get out of the curve to hold you in a more stable position. So if you ask yourself that question, am I in my curve pattern? And the answer is yes, then we have to think, well, what adjustments can I make to get out of the curve? If you can get out of that curve pattern, put yourself in a more stable position and continue to do the exercise or movement, it is likely a good exercise for you. If you find that you can't, well, then I think we have to rethink what you're doing. Is that movement necessary? Are there things that you need to work on first to build up to that level that would make it maybe not the best exercise for you right now? That's not to say it won't be eventually and you can't build towards it, but maybe not in this moment. Another phrase that I often teach patients or teach people that I'm working with when it comes to assessing whether or not a given movement is a good movement for you in this time period is to think about if it is putting you in end range, flexion, extension, or rotation. So end range meaning going kind of as far as your body can naturally go and maybe pushing beyond that just a little bit, whether that's flexion like I'm doing now or extension, or even getting into rotation. those tend to be places where we are more likely to see instability, more likely to see collapse into the curve. And so, not to say that you always have to avoid those motions, but to make you really have some caution and awareness and possible modifications depending on what is happening with your spine. Those are harder movements to do well and maintain a stable position and avoid the collapse. So again, there's really no perfect answer to this question. It's really hard to say these exercises over here are good, these exercises here are bad, because movement is movement and all movement has the potential to be good. But it is a question that we should be thinking about when it comes to scoliosis, because we need to assess, is this particular movement at this particular time a movement that I can control well to maintain that stable spine, to avoid collapsing into my curve? If yes, wonderful. It's likely a good exercise for you. If no, then again, we need to backtrack a little bit, rethink what you're doing, why you're doing it. If it's something that is very important to you that you really want to get to be able to do, you can likely work towards achieving that, but maybe it's just not in this moment in time. So no black and white answers here. It really is on this continuum. If this is a topic that you're interested in, I'll be doing some more videos to demonstrate scoliosis-friendly exercise routines, exercises that are more likely for the majority of people to be able to do without that collapse, without kind of falling into their curve pattern. So definitely subscribe or follow if you want more things like that. I'll also be giving some more demonstrations on how to figure out what your curve pattern is, how you can assess that and start to answer that question for yourself of, are you in your curve pattern? Which is one of the most important questions that you should be able to answer if you have scoliosis. All right, thanks for watching. I hope you found this helpful.